Okay, here we see some leukoplakias. This is the entrance of the bladder, and urethra seems too much vasculated, but there is no infection in the urethra, which is a good thing, and no stricture, no scaly gland infection. And inside the bladder, in the entrance, I can see the leukoplakia tissues, and here the trigone is infected. It's not normal like this. This is a normal bladder wall. This is a normal bladder wall. But here, the trigone is inflamed. This is a ureteric orifice is here, right ureter, and this is left ureter. The urine flow normally, and this part we have abnormal tissues, not very abundant, as she is not having these issues for many years, but she has. Look at the normal mucosa, and here the inflamed mucosa. We have to be very careful because here it's very close to bladder neck. I have to specify a mark here to stop. Ayağını yaklaştım.
Aynen hocam. Çekme hocam.
Okay. Okay, here we see tissues, abnormal tissues here. I will mark here. This is the place I have come. And these places I will fulgurate. Here the normal mucosa, until here I will fulgurate. Okay, this is already seen by her doctor in Sweden. Okay, maybe this is the main cause of all her complaints. Very interestingly, in the upper part of her bladder, we detected a sponge. This is a sponge here. Look at this. This is yeast infection sponge. We will take it out. Okay. Pause it. Try to take it out. Now I will try to take it out. Okay, I think it came. We are trying to warned us about this. There may be a sponge in the bladder, and when I look, I was expecting to find only yeast infection, but we find a big spongy tissue, and we take it out. This may be all of the reasons of her complaints, but here also we will fulgurate the trigone. Just don't want to miss anything. Okay, perfect. So I am making the last controls for this sponge. There is nothing else. Very too much pieces here. There are some particles. It's like a lipoid tissue, like a yeast tissue. Maybe because of using too much antibiotics before, there may be a yeast formation. Yeah, okay, we cleaned it now.
Ama çektim.
Okay, now we are fulgurating the leukoplakia tissues here. They are close to urethra, but really not too much. I am now satisfied with this yeast infection, finding the yeast infection. But I don't want to leave any abnormal tissues here. Biraz yükseltin.
hocam bir açıyorum.
Okay, and urethra here we see real vascularization, increasing vascularization. Maybe. Here you can see the inflamed tissues, but compared to other patients, this is a benign, I can say it's a benign trigon. I think the most important problems were because of this yeast infection. And I really expect a good recovery from her. It's always needed to make a cystoscopy. If there is some chronic problem, there will be something wrong inside the bladder. Sometimes this is a leukoplakia, sometimes trigonitis. In this lady, it was a sponge tissue in the bladder. So it's not normal to have chronic inflammatory problems all the time, having too much infections throughout the year. If you are having more than 3 infections a year, there will be a problem in the bladder. So we have to look inside and see what's this problem is. This vascularization, all because of too much inflammation in the bladder. Okay, these are our borders. I can pass beyond this line. This is ureteric orifice here, and I think this will be enough for her. And the urethra is completely normal in regards of infection, but there's too much vascularization. I don't want to leave any inflamed tissue behind, so I will clean these tissues. So in general, when we look, the trigon is now treated. I will treat these parts too. Okay, when we make the last control, the trigon is now treated. We came close to ureteric orifices. Always I look after trigon to the opposite part in the bladder, and you can see here when I focus. Look, this is a normal bladder wall. This is a normal bladder wall. In between this part, it's the part which comes into contact with trigon when the bladder is emptied. I am emptying the bladder now. I think this part will come into contact with the trigon when the bladder is empty. Just pause. Okay, now it's coming closer. So, look at this part. It's coming into contact with the trigon when I empty the bladder. What does it mean? It means the infection in the trigon disseminates through the bladder wall which it is in contact with. So this part, it is in contact with, it comes into contact with this part, and this part is inflamed. Then what is the next stage? Next stage, inflammation will disseminate to all the bladder walls. And maybe these ladies become interstitial cystitis by time, because when all the bladder walls are inflamed, we call it interstitial cystitis. So I am fulgurating this part also. Just to stimulate new tissue healing here, and to kill the inflammation, to stop the inflammation in this part. I think our results changed after we start doing fulguration of these focal inflammations, if we can. So look at this part. Now it's in the middle of the bladder. Here there may be some vascularization. I will just touch to here. Okay. Now I will empty again the bladder. I also vacuum clean the bladder by this way. One more time I'm checking for the sponge tissue. Okay, look at this tissue. The part I fulgurated in the opposite walls just come into contact and sit on the trigone. This is meaningful. This means something. So my theory is inflammation disseminates from this trigone to opposite wall first, then to other parts of the bladder. So don't delay to get rid of this infection. Don't wait too much. I recommend this to anyone.